Ashley. My name
Hi.
is Taylor. Hi. I'm a nurse practitioner student at Youngstown State University. If it's okay with you, I have a few questions I would like to ask you.
Okay, sounds good.
First, can you tell me a little bit about yourself?
Sure. Well, I'm from the Youngstown area. I've been here most of my life. I went to nursing school directly from high school. I graduated in 2013, and I've worked at St. Elizabeth, Youngstown, and Boardman most of my nursing career. And went back to school, graduated in 2020, also from Kent State, and been working as a nurse practitioner since then.
That's awesome. Have you liked it?
Yeah, it's been good so far. Ups and downs for sure.
Can you describe your APRN position, including your specialty now?
Yes, so I work for a pulmonology and sleep medicine practice. So I work a hybrid of inpatient and outpatient, as well as long-term acute care hospital patients.
That's awesome. What made you want to choose that specialty?
Um, so I think my nursing experience kind of lent itself to this type of work, working in intermediate care with, taking care of chronically vented patients, a lot of pulmonary conditions, cardiopulmonary conditions, and then overall just networking and knowing people that worked for this particular group. I felt it would be a good fit.
Very nice. Do you see the APRN influence in today's healthcare system? If so, how? And if not, why do you think that is?
Oh yeah, 100%. Definitely APRN influence. I think in particular in our area, but most areas, um, basically just access to healthcare, and meeting like growing demands. So our specialty in particular, our ability to see all these new patients in a day, they would never be able to do that without APRN assistance, for consultations. Seeing new patients in the office. So I think definitely it's improved access to healthcare across the board.
Absolutely. That's incredible. What are some of the barriers that you see or feel that APRNs are facing today?
Um, I think first of all, probably physician resistance is one. And I don't want to sound negative in that it's always that the case, but I think you definitely would run into physicians who aren't comfortable with APRNs just in general for whatever reason. And then just general public as well. Maybe lack of understanding of our role, what we know as providers, and like their ability to trust us is a barrier. I think given time though, being nurses first, we're good at establishing rapport typically. So I think once they give us a chance, they get better. But that is a barrier. Um, and then some, reimbursement problems, practices from a financial standpoint, need to be worth it in their eyes. So I think sometimes reimbursement is a problem.
Absolutely. Do you feel like your patients sometimes connect better with the APRNs than they do with the doctors?
Yeah, definitely. I think that all stems from communication too. And personally, just working as a bedside nurse, just you learn that so quickly. Meeting someone and then the next moment, being able to touch them and care for them in that intimate way, we're pretty good at establishing rapport for sure.
Wonderful. Lastly, what changes would you like to see made for APRNs?
Um, I think, from a political type level at the state and local government, they're working on Better Access to Healthcare Act and elimination of the standard care arrangement, which I think overall, would improve access to healthcare just in general. I don't think it applies to every APRN practicing in Ohio, but I think it certainly would help. And then the other is maybe more nurse practitioner focused education. Um, I think we can connect with, any provider education, but coming from a background of a nurse practitioner is, I think, helpful.
Awesome. Well, I would like to thank you. I appreciate you taking the time to sit down with me today and go over these few questions.
Sure, no problem.
Thank you. Have a great day.
Bye.
Bye-bye.